Hello, I'm Dr. Phil Smith of Valley Eye Associates, and I would like to thank you for choosing us for your eye care needs. If you've been told you have cataracts, it may be time for you to consider cataract surgery. There has never been a better time to have cataract surgery, and I want to tell you why. We can now get you better vision and help reduce or eliminate your need for glasses or contact lenses. Today, we will have two topics to discuss about your upcoming cataract surgery. The first topic is how you would like your cataract removed, and the second is how you would like to see after surgery. We are proud to have been the first clinic in Wisconsin to offer blade-free laser cataract surgery back in 2011 as an alternative to handheld blade cataract surgery. We call this high-definition laser cataract surgery. With the use of a femtosecond laser, we're able to make cataract surgery more precise and accurate than surgery performed by the human hand. This blade-free laser procedure is remarkable. The laser's incisions are smaller and stronger than those made with a blade, making recovery time faster. The laser also automates some of the more challenging steps in cataract surgery. After your surgeon inputs your customized surgical plan, the laser performs these surgical maneuvers with extreme accuracy. First, the laser creates an opening in the thin capsular membrane that surrounds the natural lens. This is called the capsular rhexis, and this provides an opening to remove the cataract. Studies have shown that a capsular rhexis made with a laser is 10 times more accurate than a manual capsular rhexis, which is made with a bent needle. The consistently precise laser-controlled capsular rhexis contributes to better lens positioning and therefore more predictable visual results, which is especially important with some of the lifestyle intraocular lenses used today. In order to remove the cataract, the lens must be divided into manageable sections. This step is now performed in seconds and with much less energy with the femtosecond laser. It also softens the cataract so less ultrasonic energy is required during the removal process. This means there is less stress to the delicate fibers and capsular membrane that hold the intraocular lens implant in place. To treat pre-existing astigmatism, arc-like incisions are made in the outer margin of the cornea. These laser incisions are considerably more precise and predictable than those created with a blade. Finally, primary and secondary stair-step incisions are created on the edge of the cornea with a laser instead of a blade to provide access to the cataract. These incisions are stronger, smaller, and heal faster than incisions made with a blade. The second topic is to choose the intraocular lens implant, or IOL, that will be placed in your eye after the cataract is removed. This will determine how you will see for years to come. There has never been a greater selection of implants to choose from, and rest assured, the experts at Valley Eye will help you decide which one is right for you. So please, sit back and relax as we show you a short video about cataract surgery as it is performed at Valley Eye. You will then have a chance to talk to our amazing staff about your cataract surgery options. Once again, I want to thank you for your trust and confidence in Valley Eye, and please do not hesitate to contact any one of us if you have any additional questions. Thank you.
We all depend on our eyes to help us drive safely to our destination, work at our occupations, have fun in our hobbies and with our families, and absorb information that is vital to our everyday existence. When we are young, many of us can see everything clearly, from very near objects to faraway objects. Over 50% of people over the age of 60, and quite a few younger than that, have the quality of their vision affected by a progressive eye disease called cataracts. In fact, cataracts are so common, it is said that nearly everyone will develop a cataract if they live long enough. Surgery to remove cataracts is a safe and commonly performed medical procedure. Worldwide, it is estimated that over 14 million lens implant procedures are performed each year. Today, when patients are diagnosed with cataracts, many doctors agree that the time to have them treated is when their quality of vision begins to interfere with doing things they like to do most in life. And now, thanks to remarkable advances in technology, patients can resume doing these tasks and have the possibility of reducing or eliminating their dependence on glasses or contact lenses. In a young normal eye, light from both distant and near objects enter the cornea, pass through the clear natural lens, and comes to a point of focus on the retina, providing a full range of clear vision. But as we age, beginning around the age of 40, the natural lens inside the eye begins to harden and lose its flexibility. This reduces the eye's ability to change its focus from near to intermediate to distance and back again. This is known as a loss of accommodation, presbyopia, or dysfunctional lens syndrome, and its earliest symptom is difficulty seeing things up close. Bifocal and even trifocal glasses will eventually become necessary for most people to see clearly at all distances. As the natural lens of the eye continues to age, it starts to become cloudy or brown in color, vision becomes blurry, and colors lose their brilliance. This is called a cataract. At first, changes in glasses prescriptions can help, but left untreated, cataracts could eventually lead to blindness. The only way to see clearly after cataracts advance is to have them removed and then replaced with intraocular lens implants, which were first introduced in the 1970s. Prior to 1990, patients undergoing lens implant surgery only had one intraocular lens implant option, a spherical, monofocal implant that had only one focal distance. Having monofocal lens implants in both eyes should provide good vision, but patients most often still need bifocal or trifocal glasses for their best option, as a spherical, monofocal implant does nothing to correct astigmatism or presbyopia. Today, many of our patients at Valley Eye Associates are choosing to have high-definition laser cataract surgery. Using our advanced femtosecond laser technology, several of the most challenging steps of cataract removal performed with a blade are now performed with the accuracy and precision of a laser, which also contributes to better outcomes while potentially making cataract surgery even safer. Once the cataract is removed, some patients will have intraoperative aberrometry, or AURA, performed. AURA provides additional real-time guidance in choosing the IOL power and position to optimize your vision. It is especially useful if you have had LASIK, PRK, or RK in the past. Next, the intraocular lens of your choice is inserted through the self-sealing incision and positioned securely into your eye. Typically, no sutures are required to close the corneal incisions. Today, there are many intraocular lens designs that can reduce or eliminate your need for glasses after cataract surgery. Such lifestyle implants include toric lenses, designed to treat astigmatism, and multifocal, accommodative, and extended range of focus lenses that employ different types of optics designed to provide clear, distant, intermediate, and near vision. With these lenses, you will have more freedom to enjoy daily activities such as sports, working at your computer, seeing your dashboard, or reading your cell phone or tablet with little, if any, dependence on glasses or contact lenses. We also offer the customizable, light-adjustable lens that allows you to test drive your post-operative vision. 2 to 3 weeks after your surgery, you can decide if you would like to have better distance vision or better near or intermediate vision. With a non-surgical special in-office light treatment, the power of the lens implant can be adjusted. Once you achieve your optimal vision, the lens power is permanently locked in with a final light treatment to prevent any further changes. Surgery is usually performed on an outpatient basis at Pinnacle Cataract and Laser Institute. If you elect to have a laser cataract surgery, your procedure begins once you are positioned under the laser. Your surgeon will then customize your procedure while viewing a live 3D image of your eye. Because the eye is numbed with topical or local anesthesia, the procedure is virtually painless. Once the laser is finished, the cataract is removed and the IOL of your choice is inserted through the self-sealing incision and seated into position. Whether you have high-definition laser cataract surgery or manual blade cataract surgery, you should expect to be in the operating room for about 15 to 20 minutes. You'll be allowed to go home soon after your procedure is complete, where you can relax and enjoy the rest of the day. Most people resume their normal activities in a day or so. Everyone heals at a different rate. But in most cases, vision is improved within 24 hours and continues to improve as your eye heals and you become more accustomed to adapting to your new vision. Although you might prefer to use glasses for prolonged reading, to read very small type, or to drive at night, most people report that they can conduct many other daily activities without depending on glasses with multifocal or extended range on focus IOLs. The full benefit of surgery will be even more noticeable when both eyes have been treated. Once it is determined that you are a good candidate for high-definition laser cataract surgery, you'll be given additional information about the possible risks, benefits, and potential complications and out-of-pocket costs involved with the procedure, as well as the Lifestyle IOL. Although the thought of having any kind of eye surgery can be a bit frightening, it's good to know that such a tremendously successful procedure has taken a giant step forward by providing even greater benefits. The prospect of life with reduced dependence on glasses or contact lenses.